I'm going to start out with a few text messages that I received in the last 2 years from providers of care to children affected by trauma and conflict settings. What can I tell you about the injuries we see? They're extremely severe. We start wishing for death for ourselves and the patients because it's more merciful. Children with extremely severe injuries beyond imagination. Today, since morning, we've been treating children, women, and other wounded on the floor. There is no room for a human foot in the emergency department. Yesterday was mainly blast patients, many children with shrapnel wounds, one completely blinded, most in agony on arrival to the hospital. This little child came to the hospital unconscious after a bombing. His name is unknown. He is now in the ICU. He is still unknown. I want you to take a minute and imagine that this room represents the world's children. And then look around to your left, to your right. 1 in 4 of you would be living in a conflict zone. There are about 500 million children globally living in conflict areas, and that number is just on the rise. With the evolution of weaponry and warfare, with the complete normalization of child casualties, and with the impunity and lack of accountability when it comes to international humanitarian law violations, the number has reached unprecedented levels. If we just look at Gaza alone, in the first 4 months of the genocide, more Palestinian children were killed than all conflicts globally combined over a 4-year period. And so that makes it particularly relevant that we're holding Pediatric Days this year in Amman. We're only a few hundred kilometers away from Gaza. We're in the middle of a region ravaged by conflict. For today's, and so this gives us a particularly good opportunity to highlight this neglected area of pediatric care. For today's session, we're going to focus primarily on physical trauma, but physical trauma is only one facet of the devastating ways in which conflict impacts children. Their health systems collapse, their education systems collapse, and they lose both the physical and emotional support of guardians, of safeguarding. They often lose parents and other family members. We chose to specifically focus on physical trauma because it is an aspect of pediatric care that's often neglected. In the last couple of years, I've unfortunately been part of mass casualty after mass casualty, and what was particularly striking to me is how adults and emergency care providers often felt uneasy when it came to the care of pediatric trauma patients. Meanwhile, child health specialists and pediatricians, although they have the skills to care specifically for children, often lack the essential skills for primary trauma care. And this lack of training, experience, and familiarity, as well as the heightened anxiety that comes around caring for children, was only exacerbated by the lack of child-appropriate equipment in terms of pediatric sizes, and an unfamiliarity with dosing when it came to children. And the consequence of that is that many of the children we treated were inadequately treated for their pain because people feared using the types of drugs in correct doses for those children that they needed or that their injuries required. So for the next series this morning, we're going to increase our awareness about this massive global issue of trauma in children, and we're going to explore strategies to improve survival of trauma in conflict settings amongst child patients. We're going to particularly focus on testimonies from the field and on strategies for improving pre-hospital care. We're going to start off with a testimony from a very dear friend of mine, followed by a session from the Blast Injury Group, where they're going to really set the stage for us on the magnitude of this issue. We're then going to get a short video example of pre-hospital intervention in the field, followed by a session that expands that more and speaks more about the pre-hospital space. And then we'll step back in the last session and look at all the many ways outside of war that children may be impacted by trauma by looking at one of the largest registries of trauma globally. We're going to end with a panel discussion where you'll have a chance to interact directly with the speakers and brainstorm with us ways of improving survival of children in conflict settings. Just a bit of a trigger warning, I know you heard this before, but we're going to be discussing trauma, so the presentations do contain some images of injured children.